Good morning, center stagers. This morning I want to talk about two very common medications as it relates to heart attacks. Heart attacks most commonly occur because of a blood clot that develops inside of the artery. An injury occurs inside the artery, either to the glycocalyx and then to the endothelium, and this blood clot forms. A blood clot initially begins with something called fibrin. It's like a mesh. And then that mesh starts to trap platelets and red blood cells and all kinds of debris to try to form a cap over that injury. Just as if you scratched your hand and a scab forms. That would be like the clot. Okay, so in our body, we have natural mechanism to help break down that clot. We don't want it to continue to stay there and get calcified. So we have a mechanism in our body. One of those mechanisms is for the endothelial cells of the artery to release something called tissue plasminogen activator. I know it's a big word, but it is something that helps to break down the clot. Okay? Now, most often, the two medications used in cardiovascular disease is aspirin, which helps to stop the stickiness of the platelets, and so they won't get trapped in that fibrin mesh and cause a clot to form, okay? The second way is giving a statin. Now, it's a weaker option, but if statins have a benefit at all, it would be in two different things. It would be as an anti-inflammatory medication and an antithrombotic. So what I mean by that is statins have this called a pleomorphic type mechanism, meaning it has multiple benefits. It will help lower tissue plasminogen activator inhibitor. Meaning something we don't want to inhibit tissue plasminogen activator because tissue plasminogen activator helps us to break down the clot. So we don't want to inhibit it, but there is such a thing as an inhibitor. Okay. It'll also increase fibrinolysis, breakdown of the clot. This is what statins do. Statins will decrease inflammation and also encourage the endothelial cells to release nitric oxide. So not only is the statin helping the endothelial cells release tissue plasminogen activator to break down the clot, it's also helping to release nitric oxide, which vasodilates. So there is a positive to taking a statin, but it is a weaker way to do things, okay? What if I told you that we could maybe reduce our risk of getting blood clots in the artery itself before we have to take any medications? We need to stop the injury, right? So you stop the sugar, you stop the alcohol, you stop the smoking, you protect yourself from heavy metals and nanoplastics and all that. But what if I told you that something that you might not have thought about is a cause of increased blood clots occurring in your heart arteries? You see, fat is an endocrine organ, and it releases hormones. And one of those hormones that fat releases, a specific fat called visceral fat. Visceral fat is fat in the organs and in and around the organs. So specifically, I want to refer to the visceral fat being liver fat. Visceral fat releases a hormone called tissue plasminogen activator inhibitor. So you have fat in you. If you have visceral fat, that fat is releasing a hormone called tissue plasminogen activator inhibitor. You're actually producing an inhibitor of plasminogen, which is breaking down clots. Now you're causing the clots to hang around longer. So bottom line, if you have visceral fat, you are releasing a hormone that is causing clots to hang around longer by inhibiting plasminogen from being released from the endothelial cells. Backwards, right? We don't want that. We do not want that, because that's going to increase our risk of having a heart attack or stroke. How do you stop visceral fat? We need to lower insulin level. How do you lower insulin level? lower your carbs. This is how it all ties in with this insulin resistance. If you have insulin resistance, you have abdominal fat, you have fatty liver, and you are producing tissue plasminogen activator inhibitor. That is increasing your risk of decreasing plasminogen, so it can't work to break down a clot if it happens to form inside the artery from an injury. You guys, we can talk more about this on our live stream. For more health tips and truths, join me at Iron Lady Doc. See ya.